Okay, so tell me a little bit about NAMI Washington. How did it come about?
So I'm Lauren Simonds. I'm the executive director of NAMI Washington. It's pronounced NAMI, NAMI. Either way, we figure they're just coastal accents. NAMI is a three-tiered organization with a national organization outside of DC, 49 state and territorial organizations, and every state has a different number of local affiliates. NAMI Washington was one of the first NAMIs that started in the country in the mid 70s. And NAMI really started by um, individuals, mostly mothers who were stay-at-home moms who were taking care of their kids, because in the 70s we did still have stay-at-home moms mostly, um, who couldn't find services for their kids with mental health conditions. And NAMI really formed around kitchen tables. In a grassroots manner of citizens helping other citizens doing research to find out services that um, would help their kids or help their adult children. There are NAMI mommies, we call them. So that's how we were started.
Mm-hmm. So what services do you provide at NAMI Washington?
So the state office of the National Alliance on Mental Illness, we're responsible for ensuring that people who volunteer with our affiliates have the opportunity to become what we call signature program leaders. So NAMI has 9 signature community direct service educational types of programs. We have classes and support groups, and then community presentation programs. And NAMI's programs are all led by people with lived experience. So they're all led by peers. So people who identify as a person living with a mental health or behavioral health condition, they can take a training from NAMI Washington in our peer-focused programs and become leaders, for example, of our peer-to-peer class or our connection recovery support groups. So NAMI Washington trains them, and then they go back to their local affiliate and they start offering the programs in their local community to members of the community, and all of the programs are free.
Mm-hmm. My next question is, what particular stakeholders do you partner with closely?
So first and foremost, it's important to know that NAMI is the largest grassroots mental health organization in the nation. And so our primary partners are our constituents, who are people living with behavioral health conditions, family members and caregivers of people living with behavioral health conditions, and quite frankly, the community at large, because who is not affected at this point by a mental health condition in the wake of the pandemic. So our programs and services are open to everybody in Washington. And in fact, most of our affiliates are offering their classes and support groups and presentation programs online. So we actually get people attending our programs from all over the country. People in Washington have the opportunity to attend programs being offered by other states if the schedule of programming by the Washington affiliates doesn't work for them. We also partner with the local community behavioral health organizations throughout the state. We support them. We often refer to them. They support us, know about NAMI's free programming. This includes community behavioral health centers, the variety of behavioral health hospitals and freestanding evaluation and treatment centers, any nonprofit community group that has an interest in mental health. We often have a way to partner with them. We also have support from the Washington State Healthcare Authority, Division of Behavioral Health and Recovery, and many private funders. For example, we receive funds from Kaiser Permanente Foundation of Washington, which supports our youth and young adult outreach program. So that's just an example.
Mm-hmm. What impact does your organization have on communities as a whole, particularly the mental health community?
So we know that over 30,000 Washingtonians and probably more access NAMI's peer support education programs. Um, and that's mostly the signature education programs that are offered through our local affiliates. We also at NAMI Washington take the lead in statewide legislative advocacy related to behavioral health. We conduct an annual lobby day during our legislative session. We take action on many bills and send out action alerts to anybody who is on our email list so they have the opportunity to get involved in statewide legislative advocacy. We also participate with NAMI National in federal legislative advocacy opportunities. And we have some specialized programs as well that have impact. We are currently working on expanding three very important programs. Sharing Hope and Compartiendo Esperanza are facilitated mental health discussion programs. Sharing Hope is a program we do in the Black and African American community, and Compartiendo Esperanza is the program that is done for and with the members of the Spanish speaking community. These are led by trusted leaders within those communities. So if you're attending a Compartiendo Esperanza presentation, discussion, facilitated discussion, it is led by somebody who is Spanish speaking, who either identifies as a family member or a person who is living with a behavioral health condition, or a person who is a trusted leader in that community. So those are two facilitated discussion programs for the BIPOC community that we're working on expanding. And in addition, we have a program called Provider Education. And this is either a 15-hour class or a 4 to 5 hour seminar for frontline workers of behavioral health, or any healthcare facility who's interfacing with people with behavioral health issues.
Mm-hmm. My last question is, how do you create an inclusive and welcoming environment for everyone, particularly those with mental illness?
At NAMI Washington, as I said, we're a peer-led organization in our educational programs, but also at the state level, we're peer-led on our board and on our staff. While it is not a requirement that staff need to be people who have a diagnosed behavioral health condition, and that's not anything we ever ask. Usually after somebody's hired and they're comfortable, they'll disclose. But we do have a provision that 75% of our board members need to identify as a member of NAMI's constituency, which means they have experience as a family member or a caregiver to a person with a behavioral health issue who's close to them, or they identify as somebody living with a behavioral health condition, or both. And we really, our values are to be open, respectful, and inclusive. Those are part of our values, and we do everything we can to be as welcoming as possible to people who call just for information and referral, to people who are volunteering, to people who are attending affiliate meetings, classes, and support groups. We really work to welcome people and have a fully open and encouraging workplace and service provision.
Mm-hmm. That's cool.
Thanks.